A team of scientists, researchers, and clinicians may have identified the genetic marker underlying an increased risk of coronary artery disease in men. University researchers identified that men with a particular type of Y chromosome have a 50% greater risk of developing coronary artery disease. About 600,000 people die of heart disease in the United States every year. That's 1 in 4 deaths. Heart disease is the leading cause of death for both men and women. Coronary heart disease is the most common type of heart disease, killing more than 385,000 people annually. Dr. Gary Allen, Director of Cardiothoracic Surgery at Florida Hospital Waterman's Heart Center, explains the treatment options available to those with coronary heart disease.
We are challenged with taking care of patients that have blocked coronary arteries. In general, there's 3 columns of care. On the first column would be what I would call standard medicine therapy for coronary artery disease. When the disease becomes more complex, where the arteries now do start to become more critically blocked, and there's 1 or 2 arteries typically that are blocked, those are generally patients that become candidates for stenting. And stentings are little tubes, little cylinders that get inserted in through the groin up into the arteries of the heart, and they have the benefit of sparing the patient an open surgical procedure, which is great. Patients have a much quicker return back to work and quality of life. Bypass surgery is sort of the third arm in the armamentarium for treating blocked coronary arteries. And that's when you have multiple arteries are blocked, or some of the most critical arteries in the heart are blocked. And then the best way to fix those becomes with a bypass operation. Traditionally, those surgeries have been done with the use of a heart-lung machine. But as you might imagine, it's also a very invasive machine. More recently, we've had techniques which we call OPCAB, or off-pump coronary bypass surgery. And the advantage of off-pump surgery is really quite wonderful and quite elegant. It allows us to operate on the heart while the heart continues to beat and while the lungs continue to function. The advantages, though, are tremendous to the patient. There's a lower incidence of stroke, there's a lower incidence of blood transfusions, abnormal rhythms of the patient, and also infections in the patient. So that's become really very popular. Surprisingly, it's only done in a minority of programs in the country. It's only done about 18 or 19% of the programs in the country, and I think the reason for that is it takes really a very specialized team to do that. It's not just about how the surgeon operates. It's about having a specialized surgery team both at the surgical table as well as anesthesia and as well as the support staff. So it's really a multidisciplinary approach. But the patients and certainly the hospital has really enjoyed, the success of that program.
In addition to your genetic makeup, several medical conditions and lifestyle choices can also impact whether you're at higher risk for heart disease, including diabetes, being overweight or obese, having a poor diet, lack of physical activity, and excessive alcohol use. Florida Hospital Waterman Heart Center recently launched a new dedicated website. We invite you to check out the new site, take some of the quizzes, and watch the patient testimonial video produced by Hometown Health's sister company, Appleseed Marketing. For more information on the services and procedures offered at the Waterman Heart Center, click the Coronary Artery Disease story link on our homepage at yourhometownhealth.com.